Hi everyone, Dr. Kim here, naturopathic doctor practicing in Shore Park in Calgary, Alberta. We're here in my office in Shore Park today, and I just wanted to talk a little bit about neck and shoulder tension. I feel like it's pretty common for most people to experience neck and shoulder tension. We're sitting at our desks all day, not necessarily getting enough movement, and if you're a jaw clencher like me, particularly when you're stressed, then you tend to have tighter neck muscles too. So one of the things that can end up happening when you're having tight neck muscles is what's called thoracic outlet syndrome. So all that really means is that you have tight neck muscles and it's putting compression on the blood vessels that are running through the neck muscles and putting compression on the nerves that are coming from the back, the cervical spine area that are running through the muscles and down the arms. They also run down into the body. And can create a lot of different symptoms when you're having compression on those nerves and or those blood vessels. You might experience cold hands, you might experience numbness or tingling in your fingers, you might wake up in the middle of the night if it's really bad, or in the morning and your hands are numb. So all of those symptoms can be because you have tight neck muscles. And it's pretty easy to get those neck muscles moving. One great way to get those neck muscles to free up some of that tension in those neck muscles is with acupuncture. So a lot of people don't know that naturopathic doctors do acupuncture. Not all of them do, but I do sometimes. And this is like a really easy way to loosen up those muscles. So I wanted to actually give you guys a little bit of a demo on me today because a lot of people have fears about acupuncture. Needles, of course, is it going to hurt? None of those things really happen when you do acupuncture. The worst often happens is maybe like a little mosquito bite. You might feel like a little prick, but for the most part, it doesn't hurt. I'm not a fan of needles myself. When I go give blood, I pretty much have to lay down on the table, and I can totally put acupuncture needles all over myself. So I'm going to just show you what it looks like and how easy it is to loosen up the neck muscles with acupuncture needles. Okay, so we're all set here to do some acupuncture on my neck muscles. What you often want to focus on when you're doing acupuncture for tight neck muscles is first off the trapezius area back here, and then the scalenes that come from the back of the skull right down to the clavicle, and often the sternocleidomastoid that runs right in front here. Those are all like kind of the main neck muscles that are going to potentially be tight and causing compression on the vasculature and the nerves that we talked about before. So I'm not going to do all the muscles, I just want to give you an idea of a couple and what it looks like and how really painless it is. So I already disinfected the area because that's the first thing you want to do when you're going to do acupuncture. And I'm just going to show you, this is what an acupuncture needle looks like. They're pretty tiny, so nothing like what you're used to seeing when you go get a vaccine or have blood drawn. These are really, really small. So I'm just going to insert it into this little guide tube. It just makes it a little bit easier to put it into the muscle. And then all I'm going to do is feel around in the muscle for some tight spots, what are often called trigger points. When you go right into the trigger point, it totally helps the muscle just relax. So I can feel one right there. It's pretty tight. So I'm just going to go right in there with this needle. So it totally doesn't hurt. I think you can see it right there. It doesn't hurt, but I can definitely feel it in that tight muscle. It's just helping the muscle loosen up. And I'm going to do one more on the scalenes here. These are often really tight for people. If you palpate your neck, you can feel how tight they are. And you'll find a spot sometimes, and you can just feel it radiate, say, up into your skull or down into your arm. That would definitely be qualified as what we call a trigger point. So I can find a pretty decent one right in the front there. So I'm just going to stabilize the muscle between my fingers, and then I'm just going to go in with the needle. so that's it. Super simple. I can totally feel that when acting. It's sending some radiating. Like I said, doesn't hurt, but it definitely helps loosen things up. So I'm just going to sit with these needles for a little while now and let them do their thing, and that's it.